I think the biggest joy that I get out of cardiology is when we take care of a patient who has had a heart attack, who is in really dire straits, and we actually can make a major impact and many of those times actually save a life. That's the most exciting thing that we can do. But we certainly also take great pride in seeing patients who, after going through a major event, bypass surgery, angioplasty, are seeing them 5 and 7 and 9 years later still doing well without a need for another kind of treatment. And that really is a credit to the excellent preventative strategies that are available that we work together with patients to try to achieve. But making these major life changes like quitting smoking or changing the diet or committing to regular exercise, that's really where the difficulty can happen for some patients. But those patients that commit to those changes really enjoy an excellent quality of life and enjoy great longevity. When a patient has the onset of chest pain, it really is an important and serious problem. All of the data that has been published suggests that the earlier a patient interacts with the medical system, the less likely they will be to suffer a consequence from heart disease. Whether that patient is actually having a heart attack or having the symptoms that precede a heart attack, either way, early recognition and treatment is really critical. So speaking with your primary care physician, or if you don't have a primary care physician, seeking an opinion from a cardiologist would be an excellent first step. I think patients who have a history of heart disease really should see a cardiologist at least annually. Many patients who do very well over the years continue to do well and may not need a cardiologist for a procedural-based situation, but there is constant changes in the preventative literature that we can make modifications. The communication with the patient is really important, and often a lot of what we say in the office may be forgotten, and we try to do several small aids to memory. We've developed a medicine card that every patient gets that they carry in their wallet, which is a really helpful strategy for patients to always have with them, that they can take to their other physicians, that is updated regularly at each visit with a patient. The primary care physician is like the captain of the ship. As cardiologists, we want to take care of the heart, which is like the engine of the ship, so we're the engine room guys, and we want to manage that and be helpful with the management of that, do what's necessary in terms of fixing that and keeping it well. But the primary care physician is really the captain of the ship. Often there are other medicines that patients are taking that can interact, and we make an effort in all of our patients to interact and to keep informed the primary care physician. After each visit, a primary care physician will get a note from us about the status of the patient, what medicine changes may be suggested or actually were made, and how the patient can be managed by all the patient's different physicians. And we try to actually keep all of the patient's physicians in touch with the patient's heart management or cardiology management. If a patient has a cancer physician that they also see, or a dermatologist, or even an eye physician, we try to keep all those other physicians in contact with the treatments that are ongoing in the cardiology area. I think patients get really excellent care in the model that we have at Pentucket Medical, in that patients have a hybrid of getting local excellent care by board-certified cardiologists working in a team with other physicians in the community, but also have access, ready access, to outstanding academic medical centers.